There is a massive movement happening within the longevity and aging landscape. It turns out there is much we can do to extend our lifespan and reverse the effects of aging. What we've been taught and led to believe about aging and human disease are now outdated and no longer accurate. That means it's time to change the current mainstream paradigm and have different kinds of conversations when it comes to our well-being. And it's time to recognize that we have the power within ourselves to dictate and drive our own health span and aging journey. Hi, I'm Suzaida Hippolito, host of Timeless Vitality, where we are redefining aging so we become truly timeless. We're going to step into a different kind of conversation. Therefore, for the next 30 to 45 minutes, my ask is that you listen with an open mind. Just be open. Then, after you hear all the information, then you can decide what you want to do. Now, the reason I'm asking this of you is because we are going to challenge what societal and cultural norms have taught us, have taught you about how you think about your health, about how you think about your body, and what you think and how you think when you go to the doctor. The current system, when it comes to mainstream medicine, healthcare, and pharmaceuticals, is not designed for our optimal health and wellness. If it were, then why do so many of us have such poor health? If it were, then why do so many of us suffer from one disease to another? If it were, why are so many of us reliant on pharmaceutical medications? The current system has a different purpose, and we're going to talk about that purpose. And we're also going to talk about other systems that are emerging more and more into the mainstream. And those systems have the other purpose of optimizing the human brain and body and truly, truly unlocking human potential. It is my experience that when we open our minds and start thinking differently, then we can see the world differently, which means we can see ourselves differently, which means, let me say that again, which means we can see ourselves differently. We can make different choices. We can make better choices. There's a famous quote by Albert Einstein, and he says, we cannot solve our problems with the same level of mind that created them. And so allow me to introduce Dr. Sienna Steckel. She is going to help us elevate our mind and elevate our thinking. Dr. Sienna Steckel, sorry, am I saying your name correctly? Your last name, Steckel. Okay, let me say that again. All right. Allow me to introduce Dr. Sienna Steckel. She is going to help us elevate our minds, elevate our ways of thinking. She's a board-certified emergency medicine doctor who practiced for the past 15 years in different clinical settings, including inner city, rural counties, trauma centers, and at university hospitals. She got her medical degree from the University of California in San Francisco, and she did her residency at Emory University, and these are top medical schools in the country. And now, what she calls in this second season of her professional career, she's stepped outside conventional medicine because she has a huge interest and a huge passion in researching new and different ways to serve her patients truly, truly with the purpose of optimal health and optimal wellness. Welcome, Sienna. Thanks for joining us. And now I always like to ask my speakers, where in the world are you? Because we have speakers from all over the world.
I am here from Fort Lauderdale, Florida.
Got it.
Yeah, I think I'm still chasing that sun. One of these days will find me down in the Caribbean, probably. But it is what brings me down to this area. Literally, is the ocean waves and the sun. But it's beautiful here.
Yes, yes. that vitamin D. There's something to be said from with that vitamin D. Now, I'm going to get right straight into it because you made a pivot from emergency medicine into the area of biohacking, basically biohacking, holistic wellness, working with things that work with the natural intelligence of the human body. Walk us through your journey. Like, what was it like for you in emergency medicine? And let's start there.
Oh, that can of worms. It. I got into medicine because, to be honest, I used to say this, and I wondered why I fought with it as a profession internally. Is because I used to say I hate doctors, and so I wanted to prove them wrong by doing preventative medicine. I thought the only way that people would take anything I had to say with any validity is if I had an MD behind my name. And so I went, I was very naive. I didn't know any doctors really outside of my pediatrician growing up. I didn't have a family of doctors. And I joined the rat race. And emergency medicine found me. It fit the personality style that I was at that time to a T. And
Mm,
it still does. Unfortunately, it's not the same. I was going to say beast. I don't know if that's the appropriate word. It's not the same infrastructure as it was when I joined it 20 years ago. And I'm not the same person. I
mm,
see things very, very differently than I did at the time. And in the pivot wasn't just because of the frustrations of being a practitioner in this environment and feeling like my hands were tied. That was a component. But I honestly was just not happy. I would say I was
mm,
miserable.
mm,
And the white knuckling it, I can do this, the raw that ended up being at my back when I just had to literally, the lifestyle had was a very good for a type A perfectionist, go getter, and after a while, my body was like, oh, "We're not going to be doing this anymore."
mm,
And my mind had to keep up and had to catch up. And the way that I looked at things and looked at how I defined my identity with my profession and my identity outside of my profession,
mm,
it wasn't healthy. And I didn't know why I was so much in pain and unhappy. And so, on my own organic journey of, I would say, finding myself, but it is finding that deeper sense of what aligned with me and why I was doing what I was doing, opened up Pandora's box. And
mm,
very organically, and I like to use the word rabbit holes because it was like squirrel, squirrel, squirrel. And I just went down each one of them and ended up amassing a new way of looking at wellness and or who I am I
mm,
and what is this biological being that I'm experiencing, and
mm,
found new ways, actually found old ways of practicing that were very new to me and new technology and stuff, and have been able to, from a bird's eye view, see how they all can coalesce and can be used at the
mm,
right time in the right place.
mm,
Um, that created all the diversity of things that I am able to speak about and provide now, which we can get into
mm.
later. That's a long.
Yes. Yeah. No, I love that because I'm always so fascinated when Western trained physicians merge into or enter this whole other world of so-called medicine, if you will. It's Eastern medicine, integrative medicine, holistic medicine, naturopathic medicine.
Too many.
And what was that?
I said too many more titles, but eventually, but it is. It's and it can get confusing. But sorry, go ahead.
Yes, yes. No, I mean you are the expert in this. And where I'm going at with this is first I want to clarify that um even though you started in conventional medicine and have kind of branched out of that, there Now, can you share your perspective around what we talked about around the purpose of that system? Because it's not that, because at first when I talked to you about this and what we were going to interview about, I came from the perspective of that system is broken. And you helped me shift that perspective. Like, let's not think about it as it being broken. And so I want to dive into that perspective because there's something really juicy there for, like you said, changing the way that you started seeing things. So let's go there.
Yeah. The question, and it's commonly brought up, is that we got to fix something that's broken. It, in my immediate response was, it's not broken. It's actually perfectly designed and implemented to do what it was intended to do. It just so happens that that intention isn't necessarily what I would define, or what I would feel most people would define as their goal and intention, which is internal vitality and wellness and
Mhm.
not being dependent upon medications or something else to sustain them. The purpose of what we would define as the current medical model had a different reason. It had pathology. It was to diagnose something, and to diagnose something, you have to have a treatment. And so the treatment isn't to no longer have this issue. The treatment, they thought, was just to maintain it. So if they diagnose you with diabetes, it wasn't to
My
help
beautiful.
you. Nice. It wasn't
Sorry.
no longer have diabetes. It was, how do we just get your blood sugars under control? Or if it was hypertension, it wasn't how do we look and see how this individual will no longer have hypertension. It's just, how can we get your numbers better with medicines? And so, and there's a lot of other examples, but what it was designed for is perfect and it runs great. It's just not how I would want to provide wellness and care for myself or for anybody else. So we need a new paradigm of what our goals are when we are seeking anything.
Mm, mm. A new paradigm. Yes, that's what it is. I love how you describe that. It's recognizing that the system is doing exactly what it's intended to do. But the thing is, it doesn't match our current goals. And I would say that oftentimes, too, people don't necessarily know what their health goals are. They just want to know, I want to not feel this way anymore. I want to not suffer from this anymore. And so, walk us through some of the ways that we can kind of shift from the I don't want to feel this anymore to also a different way of thinking on the clarity of what can be my health goals, like what can I aim for, and how can then I find the systems that are going to help me achieve those goals.
It starts with exactly what you just did. And that was, you change the verbiage of, I don't want to feel this way, and focus on this, versus, I want to feel this way. Whatever we tell ourselves we don't want, or whatever we focus on, our body is going to create. Our minds are going to be attracted to uh, that question, and so we're going to only find the answer to that question,
Mm,
which is going to be, if it's, I don't want to feel like this, since it doesn't know what you want to feel like, you're going to find band-aids. So you're either going to escape, or you're going to find a med, or you're going to find something to take away from whatever it is you don't want. If you
mm,
start asking the question, then, what do I want to feel like?
mm,
And then the possibility and the options and the agency, you open yourself up to, okay, I can do this, I want this, and you bring that in. And I'm not just talking about frequencies, even though that's what this is, but I'm talking literally, those options become more present to you because you've opened yourself up to the possibility of whatever a treatment modality or exploration may even be. Oftentimes,
mm,
yeah, and it goes back to what I didn't say earlier, I had previously, is when we look at something that is broken, or we look to blame something else and thinking that we're gonna, it's fighting fire with fire. And your that energy of fighting something that's broken, or I'm not going to have this in my system anymore, it's a negative energy. And our cells are going to be constantly in a fight or flight, or constantly in a locked
Mm,
state.
mm,
Number one thing is to change that perspective and say, how can I be my best self? Or how can I, instead of saying I don't want pain, how can I feel comfortable or free? And you can even say painless. So changing that first. And then it is kind of, unfortunately, now we have to do the research of finding who am I aligned with that's providing services that speaks to me. And
mm,
because it's not a one size fits all, and there's a lot of different modalities out there in this alternative, which hopefully will be mainstream soon. And you have to find what works for you. If you're not somebody who wants to sit around listening to sound bowls and take cold plunges and do some of those, then that's not your jam. But your jam
mm,
may be, okay, how can I optimize my hormones? How can I get on a better cycle? How can, find something
mm,
that aligns with how you see the world, and find
mm,
somebody to speak that language with you.
mm. That's very, very empowering. I love that you're in that way that you describe. How can we go about thinking from from thinking going from thinking I don't want to feel this to thinking this is what I want to feel? I think you stated so beautifully. It's getting clear on what it is we want to feel and speaking that in our minds. And now, and I also love how you tied into, okay, so now that you're clear on what it is you want to feel, what are the services, what are the systems, who are the practitioners that are going to help you get to what you want to feel? And that brings me to the alternative options that
Mhm.
you started to touch upon. And in your practice, there's so many different modalities that you work with. And I'm just going to name a few for the
Sure.
audience. And I'll put this in the show notes so you don't have to write this all. But here are some of the modalities that Sienna works with. We have peptides, precision medicine, ozone therapy, bioidentical hormone optimization, functional medicine, light frequency, magnetic, and harmonic modalities. There's mitochondrial and cellular health, ketamine assisted psychotherapy, mindfulness and identity structures, advanced biologics, neurofeedback, and brain mapping. And there's even more than the list that I'm looking at here. So, of those, could you speak to any of those modalities that you find are the more common ones that you utilize in your practice?
Sure. And I'll tell you that I used to think, well, everything is an evolution, and I'm learning something new literally every day. And I know it can seem like, if she's doing all of these things, can she really know anything about any of them?
Mm,
And I respect that. I also am very much of a collaborator, that if I think that somebody needs a specialist in a certain area, having an understanding of all of these and working with people who are specialists, let's say a dietitian, if I think somebody is going to be optimized on a ketogenic diet, why I'm trying to optimize their metabolism and things, then that's where I love working together with people like that, because that's their bread and butter and they're specialists in it. And I get really excited about being able to bring these all together. And I learned that I can provide these special biologics, our stem cells. One that I'm most curious about right now are called V cells. And even with stem cell therapies, and I found this out the hard way, because I always find out I'm the guinea pig for everything first. I will never offer anything to anyone if I haven't done it first. But I did a whole week of stem cell therapy and I didn't feel any better. And that was because
mm,
I was really toxic at the time. I had mercury poisoning and my gut was a mess. I had SIBO. And I then realized, okay, crap. Now I'm going to have to learn really well about detox, and I'm going to have to learn about metals and all these
Mm.
other things, because there's not one treatment or modality that's like what's the word I'm looking for? There's not just one that is one and done, right? And so it's finding where somebody is, meeting them there, and seeing which
Mm.
part of the spectrum needs to be addressed first. Because
Wow.
if somebody isn't feeling well because they've got, you name it, Lyme, long COVID, adrenal fatigue, these are all words that describe a system. But if their system needs help, I'm not going to throw them stem cells yet. We're going to deal
Mm.
with their environmental exposure,
Mm.
mindset, their nutrient deficiencies, their sleep, and then tier on some of these other amazing modalities. So, but if somebody's already fairly primed, their biological age is half of their chronological age, and they're really pushing the needle, and they're like, okay, what else can I do? Then then we'll start doing maybe some B
Mm.
cells, peptides.
Mhm.
Um, there's some
So
amazing
it's almost
protocols.
like you got to clean up the structure. You got to clean things up before you start adding things in order
Yeah,
to know what you need to add, right?
yep. Because we can Google or ask 10 doctors or 10 providers, and you can get 10 different opinions on things. And we can say, hey, this is good, but is this good for me now? There's all these
Mm.
wonderful things out there, and they all are great,
Wow.
but is it good for who I am and where I am now? And that's
Mm.
a lot of confusion. And one of the best examples I give
So
is
different.
like cold therapy. Yes, it's great. And it's great for that little hormetic stress. But if you're already stressed to the nine, you're not sleeping, you've got two jobs, you got three kids, and your adrenals are kind of shot and your body's screaming for a break, and you do a cold plunge,
Mm.
you just stress it even more. So even though it
Mm.
should be good for you, it's actually working against you. Or if you just did a massive workout and you're like, I'm going to get some gains, I'm going to get some gains, and then you go jump into a cryo or a cold plunge, you've just erased all the gains that you could have made from that workout.
Yeah.
And so I love these modalities, but there's some confusion around when to use them, and that's why I want to talk more so that people are using them in ways that are going to help them.
Wow. That's that makes a whole lot of sense. I mean, our bodies are these highly intricate, complex piece of human technology, and everybody has a different way of living. We all have different belief systems that impact how we live our lives. We all eat differently. We have different stressors. I mean, there's so many variables. And what I'm hearing and what you're sharing is you truly look at what is going on with you, like the unique individual that is you. And you do a deep dive, and that's the starting point. That's the starting point.
Yeah. And recognizing that that person's reality and that person's existence is theirs. And
Mm.
they're just because one thing worked great for your best friend or your sister over here or something doesn't mean it's right.
Mhm.
And
Mhm.
so the most powerful thing that I like, and we talked about, is asking ourselves, why am I doing what I'm doing? At
Mhm.
all at all points. I mean, like, why am I going to the grocery store right now? Why am I diving? Oh. And if we can start asking ourselves those questions and
Mm.
unlayering, it allows for our bodies to get in line, and actually allows then me as a provider to work in alignment with that.
Mhm.
If I can put together, that's why I always tell my clients or patients that it's a conversation, and I'm going to throw out ideas. If it doesn't resonate with who you are right now, then we're not doing it.
Mhm.
And and there may be some things I might push a little bit because I know the resistance is because of some other belief block, and they just need a little push.
Yeah.
But the most important thing is your own agency and your own uh,
Mm.
creation of this internal self confidence. and I'm just a conduit, or a voice to guide you.
Mm-hmm. Mm-hmm. Well, and what you're talking about too is very different from how we've been taught to think. We've been we've been taught to like not really question and not really be curious about our own treatments. We're like, we feel something about ourselves that just seems off. We go find a doctor, we go see a doctor, the doctor runs some tests, maybe talks to you for a few minutes if you're lucky, and they write a prescription and off you go. And off you go. Like literally that's the format, the framework that we've been taught. And here you're talking about really getting curious, asking very introspective questions. I'm even going to throw in intuition, like intuition. And I know one of the things that, and I'm going to tie this into this, one of the things you've mentioned already is this idea of agency. What do you mean by agency?
I mean, taking responsibility for who you are and how you show up, as this is your business, this is your company, this is your, and you are empowered in a sense, but you're taking on the responsibility of yourself with, and then being able to get guidance and get feedback from it. But it is a self ownership, and
Mm,
it is an action that is dependent on you being the one taking that action.
mm,
That's the only way anything sticks.
mm,
Otherwise, ultimately, we end up self sabotaging, or we wonder why things aren't working because we're not truly invested in this desire or this goal. And we don't even realize.
mm,
And so there's no blame in this. This is, I have so many examples of patients or clients. I tend to call them clients, but souls that have
mhm,
come and they've been on this journey trying to get better for 20 years. And they say they've been to, I want to say 20. For some reason, I'm picking that number today. 20 different places and 20 different doctors, and they're not getting better. And they've done this, and this. And I don't know if they've ever asked themselves, or they've been challenged to ask themselves,
mm,
who would you be if you didn't have this disease or this condition?
mm. Wow.
Are you willing to give it up?
Mm,
And usually people get very defensive, thinking, "What, you think I want this?" And that's not the question. The question is, it serves a
mm,
purpose. It's there for a reason until we no longer need it anymore. And that's a lot more to swallow for any of us when we have our
mm.
identity in something. But it's something that's very important to ask ourselves when we're, that's why I say, what do we want? And
Yeah.
what are we willing to let go of to get what we want?
I mean, we've normalized our states of suffering. You know, I wow, when you ask that question, repeat that question again. Who would we be without this disease? Was that the
Mhm.
question? Okay. Who would
Or
we be
condition.
with, or condition? Yeah. Who would we be without these disease and condition? That is such a poignant question. I mean, when one of the things I suffered from was anxiety, like big time anxiety. And that was really debilitating for me up until I'd say 2022 was when it started to diminish. So just very, very recently. And by the time I got there, like I knew I started believing there has to be something else. Like I I can be more like, what would it be like for me to not wake up anxious, to not move throughout my day anxious? Like, what would that be? But before that, Sienna, I thought that that was my normal. And I just like accepted it. Like, okay, I guess this is how I am, and there's nothing I can do about it. And like, how many people in the world walk around thinking this is just how it is, and there's not much I can do about it?
Yeah. I didn't address the fact that we aren't, providers aren't asking somebody how they are feeling, and
Mm,
because you know your body. And so if I'm going to, so that feedback is always important. So I want to make sure we didn't forget about the point that you're the master of your body and you know how you feel. And if I, let's say even if I'm starting somebody on hormones and my lab says you should be fine, but you're looking at me going, I feel like crap. You have to believe the individual.
mm,
So I
mm-hmm.
didn't want that to be forgotten or missed out. And then
Thank
the other
you.
part that I think the current medical model has done a huge disservice is by diagnosing somebody by definition. We had to do that for insurance companies to have a billing code so that they can get reimbursed. So if you don't have a diagnosis, you can't get a billing code, you can't get reimbursed. But if you diagnose somebody, you slapped a label on them. And so now we have somebody with anxiety, we got somebody with depression, we got somebody with diabetes, we got somebody with hypertension, we got somebody with this immune disease, label, 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 label. And then you start taking that on as who you are. So you say,
Yeah.
anxiety. And so the minute you say, I've got anxiety, you start feeling it's a self fulfilling prophecy, even though we don't know it, and it takes on its identity. So the question then is, again, who am I if I don't have anxiety? And do I believe in what is it, if it's there, what is it trying to truly tell me? Instead of trying to get
Mm,
rid of something,
mm,
I particularly think that anxiety and depression and some of those, that genre of topics or emotions, they're superpowers.
mhm,
If you can look at it and say, okay, this is my body telling me something, and I'm just not listening, I'm holding on, or I'm trying to
mm,
ignore or numb away, it allows for a different, again, paradigm of what this sensation is going on in our body. And then
mm.
willing to let go of it in that kind of conversation.
Yes.
Um, I mean, even as doctors, when we are trained, we say so and so, 35-year-old, 45-year-old female with and then we list their disorders like that's who they
Mhm,
are.
mhm,
So we are entrained to think of that as our patients. And so all of that paradigm of how we even identify and discuss and like, no, this is somebody who feels anxious. This is somebody who
yeah.
blood sugars are not controlled, instead of typecasting. So that is also
You
going into
know,
why disease. Right?
yeah, I mean, it goes back to like the why, asking the why. What I'm hearing in all this almost is that everything has a purpose. And I can share that when I developed a different relationship with the anxiety, I realized that I would become anxious when I was being too hard on myself, when it was like the talk of, okay, Suzaida, you need to do this, you didn't get this done, you're not doing this, blah 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 blah. It was just all the self-criticism, and that's when I noticed my anxiety would go up. And then I also noticed my anxiety would go up when I was worrying about things I couldn't control, when I was worrying about outcomes. And I also noticed anxiety would go up. This was a third thing I noticed. My anxiety would go up when I was stretching myself to new levels of performance, to new levels of showing up in my life. And so to your point, yes, I've turned anxiety into my superpower as indicators of how I'm running my own life and how I'm running, managing my mind. So I love that you point that out.
Yeah. And it is the story. And if you can turn the story of this uncomfortable feeling into excitement, because anxiety feels the exact same as excitement.
Yeah,
Heart rate goes
that's
up,
true.
palms get sweaty, get butterflies in your chest. Same feeling. One is, oh my God, this
Mm,
amazing thing's about to happen. And the other one's, I feel afraid. And it's unmet expectations. We is when we don't feel that we can match what we are anticipating.
Mm. Mm-hmm.
And
Mm-hmm.
sometimes that can be really exhilarating and sometimes that can be horrifying. And so it's the story. And that's only one example. It's a beautiful example. And I love that you were able to find that switch. And it doesn't mean we're not going to feel anxious in the future. My
Mm-hmm.
gosh, we came down here to fully experience. I want to feel all emotions and not
Mm.
have, and I think it was Brene Brown. I don't think, I know that it was Brene Brown who helped me have a different relationship with the word vulnerability. I
Mm.
thought that was like a four-letter word. I thought it was the worst thing you could ever describe me as or be depicted as is vulnerable. I thought that meant I was weak, or I was weak. And she was the one that turned it into a superpower, knowing, in her definition, it is the capacity to hold any emotion and not be overwhelmed by it. Meaning I can have any
Mm.
circumstance or I can go through anything and I am fully present, knowing that
Mm-hmm.
whatever I feel and work through is going to be worked through.
Mm-hmm.
And that's where courage lies. That's where
Mm-hmm.
humility lies. That's where the
Mm-hmm.
capacity to have imagination and love and all those things that opens up a body to be vital. And when that aligns with our cells are listening. And I can talk also about cellular health and membrane health and all the juicy,
All the
unique
geeky
supplements.
science stuff.
Uh, I love giving those. Like, why do I do ozone? Why do I do photobiomodulation, which is a fancy word for light therapy and different wavelengths of light and how they affect our mitochondria, which affect and then our mood and neurotransmitters, all these fun things. And I got lots of toys for that. But ultimately, another thing that, since we only have a limited amount of time, is and the most powerful starting piece to even be open to these treatments and these other modalities is who am I as I'm showing up in this process?
Mm. Mm.
And, yeah,
Yeah. Yeah. It's, you're really impressing upon people taking complete and total responsibilities for their own health and wellness.
their whole
Now,
life.
and their, yeah, right? Their whole life. So true. So true. And how to do that together and how to do that collectively in harmony, because I love that your positioning with like the modern western way of managing our health. It's just recognizing that it has a different purpose, and you have to realize, does your purpose match with that? If it does, then that's the program for
Perfect.
you, and if it doesn't, then it's your responsibility to open your mind and seek out other ways. And so that brings me to my next question. With some of your clients, can you share some of the results, that anything that stands out, some of the results, maybe a more complicated case, if you will, that your clients have experienced in working with you with these different modalities?
Oh, geez. Okay. So for one modality, I'll give an example or a couple. I had a client who did not have free time. He's writing books, he's on podcasts, he's go, go, go. He's got no free time. And his body was literally like, I can barely walk up a flight of stairs. I'm so exhausted. And there's something else. I think he had mold toxins and a few other things. It's Florida. That's almost equals mold.
Mm.
I didn't have time to go through full detoxes and to do all the things that would be appropriate to do. He just didn't have time. So instead, we did have to do some band-aids at the time, but that was ozone therapy, like 3 times a week, then
Mhm.
other IV therapies to support his system so he can be functioning still. And shockingly, or not shockingly, after doing that enough times and getting him to move, he started feeling better. And it was
Mm.
able, and during those conversations, even though he's very in tune with himself and psychologically very uh, astute, uh, worked on his stress systems and how he was coping with other things going on in his life and changing some of
Mm.
the diet and a few other supplements. and he hasn't had an issue. I haven't had to give him an ozone treatment in 3 months, and then he just likes
Wow.
to get boosters because it makes the body feel better. So
Wow.
that took a lot of upkeep for him, but it kept him completely functional. Nobody even knew that he was exhausted in between those times. We have some stem cell therapies that have been pretty profound, turning around heart failure.
Mm.
Systems weren't even optimized. So even when I said that, I can throw stem cells at somebody if they don't have these other things in line, but this even turned one person's heart failure around to the point from being on a heart transplant type list based on function to
Mm-hmm.
being cleared for surgery in the span of a month and a half.
Mm-hmm.
And so those are kind of some bigger examples. Uh, Changing someone's diet routine and their relationship to and their sleep cycles and putting them on some bioidentical hormones, and they feel like they've just won the lottery. That
Mm.
in that category. Um,
It's
so
amazing what you can feel, right? It's amazing, like the health and vitality that you can really feel. I mean, that's how I feel with myself right now. My health and vitality, I'm like, wow, I feel like I have tremendous amounts of energy. My brain function is impressing me, even like preparing for this interview, with you. And so I'm so excited for your work, Sienna, and I'm just so thrilled that we can have this discussion and really challenge people to think very differently and to take full responsibility for their own well-being. Now, since we're talking about like the purpose of this summit is around redefining what it means to age and become timeless, how do you tie all this in to healthy aging and becoming timeless and redefining aging?
that in and of itself is the answer. Is how do one define aging for themselves? So
Mm.
yes, aging is being defined as a disease instead of just a natural process. For therefore, we can create modalities to slow down the different mechanisms that we think are contributing to aging. But I can tell you, and who doesn't know that spicy 95-year-old who's out dancing on the dance floor with her cocktail in hand, and she's not necessarily doing all of those things that we are saying that are going to be anti-aging, but her perspective of what age means to her doesn't
Hmm.
exist. She's living, she's like, I feel like a 13-year or no, that's too young. I feel like a teenager. And it's because her way of viewing the world, she's not caught up in stress and worry,
Hmm.
and she's living life. That is a recipe for your cells to say, oh, I must be a teenager. They've done a study actually where they literally they took don't quote me on some of this. I think there's 60 or 70-year olds, and they put them back in their home that their home environment used to look like a decade or 2 decades before. So they had them live in that previous environment, and after the end of the experiment, their bodies, because their bodies thought that they were younger, they walked further. Their other metrics,
Hmm.
like their VO2 max and their resting heart rate and all these other signs of vitality, was like 2 decades before. Because
Wow.
only because they believed that that was their environment. So you influence your environment and your mindset around it, and your body will make that a reality.
That's so cool.
And
That's so
it's
cool.
it's mind blowing.
And it's so
But
basic. It's such
so
a kind of basic concept, right? Right.
it's
I would like to ask you the three questions I ask all of my speakers. And the first one is, what is your number one life hack for promoting your own longevity?
getting out of my own way. And yeah, I mean I can elaborate on that, but
Yes, please.
it is staying present. And when I say get out of my own way, it's holding on to those belief systems. For some reason, I don't know why I'm holding on to them when I know they aren't
Mm,
it's if it's a thought, if it's what I say, if it's an action I do, it's recognizing, I'm like, why am I doing this?
Mm-hmm.
And step out of that and be present. Uh,
Mm.
has been the biggest
Wow.
contributor to who I show up for now. As
Wow. 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 I love that one. The second question is, where do you see the future of longevity?
well, well, since I just got off a Zoom with a cohort of longevity radicals, is what I'll call them. I mean, they are way ahead of time, and they're talking about this ageless AI or something like that. So it's a meld of artificial intelligence and longevity markers. So it's going to be a beautiful marriage of technology and, to me, mindfulness. Because I think we're
Mm.
going to see an appreciation for this whole consciousness thing, which I know is kind of just, it's not as developed and understood well yet, which also incorporates the basics, the grounding, the what I call the basics, what we put in our body, how we sleep, how we move, those kinds of things. And tech, the ability to acquire data and the ability to monitor, to guide how we maybe are working with and without our body in this existence. And so,
Mm.
and they can coalesce where they work synergistically. It's not, AI is not going to take over humanity and our bodies and we're just going to become passive. We have to have agency and use these tools in a way that supports us, not become
Mm.
complacent and just pass off the responsibility to tech. And
Yeah.
I think there's a lot of wonderful things out there that are going to be combining these, and possibilities are endless, believe it or not.
So good. So good. So disruptive. And like you say, possibilities are endless. Thank you. Right. The third question and final question I ask all my speakers is, what thought or act takes you back to a childlike, playful state?
Dancing.
Yes, I love dancing.
I'm going to age myself. You throw on an 80s song, and I'm going to be up singing and dancing. And that's
Yes. All right.
the other one would be playing with dolphins or in the ocean somewhere doing something like that. Yeah, I'll have a permagran. But
Got it. Now I know how to surprise Sienna and totally light up her day. Oh my goodness. Thank you.
thank
Any
you.
last parting words for our audience?
I know it's just a pleasure to be able to provide any source of perspective change or support or guidance on this journey of life. And
Mm,
the idea is we want to embrace it wherever we are in this journey, not
yes.
to criticize where we are or bash where we've been, but be excited where we are and where what may be next, but not
Hmm.
focus on what's next. It'll come. Guess what? It happens.
Hmm.
That's what happens. It always comes. Um, and if I can be any part of that or provide any guidance or just even questions, I'd be honored to.
Yes. Well, thank you so much for speaking possibility and elevating our level of minds, elevating how we can think about our health, how we can think about our bodies, and how we can think about managing our own wellness. There's that thumb
Mind that
that
thumb.
always, I know, it pops up. It's an AI thing, and I'm still, because I talk a
Oh,
lot with my hands. Yeah. So it just will randomly pop up when I'm on video calls. So there you have it. Thank you, thank you, thank you. I hope everyone enjoyed this. I know I have, and I cannot wait for each and every one of you to step into the world, out into a world with this newly heightened level of awareness, to fully embrace your own health, your own well-being, and make different choices for forward momentum, and in a way that is purposeful and in alignment to you. So thank you, thank you. Thanks again, Sienna.
Thank you for your platform. Love it.
Much love, everyone. Mwah.